Matt Landers, and also our Public Health Director for both Genesee and Orleans County, Paul Pettit. Today, we just need to take a moment and to think about the fact that we have been working through this pandemic for a year now. And I know that I am joined by Legislative Chair Lynn Johnson from Orleans County in saying that we have found together through this 1 year that we are all in this together. Whether it's been through fighting our way to getting testing capacity to learn about the virus. Together, we have grieved as one community for those folks that we have lost. And together in this tragedy, we have found strength in our community. As we work today to continue to put these shots in the arms at our vaccine clinics, we are really requesting that when you can, please do stick your arm out and be part of our health recovery, because without that, we can't recover our economy. And we would really like to recover from this pandemic for every single community in our counties, because it's important. We recognize that there is still whipsawing going back and forth on precautions and executive orders, and it's difficult and it's frustrating. So from me to you, our goal remains the same. Shots in the arms. The vaccines are coming, not as fast as we'd like them to at times, but we're going to get there. Today at our vaccine clinic, we're doing over 600 here in Genesee County at GCC. And I will tell you, every single shot matters. Every person who puts their arm out for a vaccine is helping us to recover. Thank you. I am going to step off and hand this over to Matt Landers, because I too am working and being part of the volunteer crew that's getting this done for Genesee. So Matt and Paul, it's all yours today. Thank you for your leadership. Thank you for the county staff that you're providing to us, and to our entire community. Thank you for your volunteer service, because we matter here in Genesee. Thank you. Paul, Paul and Matt, good morning.
Good morning, Shelley. Thanks a lot, and thanks for your volunteering. It's great to hear. Great to see you over there. I know Shelley's been putting a lot of time in over there, volunteering at both our testing and our vaccination clinics, as many legislators and other county employees have been doing. It's great to see. It's one of the silver linings in this whole process, is to see so many county employees and community members step up and help out at these clinics and give of their time. I also want to thank the press and everyone that's on this call. You know, this is the county's continuation, management's continuation, and Paul's continuing effort to bring the messaging to the people of information that they need to know and understand, and give the opportunity for our local press to ask questions of Paul Pettit, primarily our own local Dr. Fauci, who's been doing a tremendous job of keeping us informed of the regulations. I want to take a quick minute just for a quick thanks to, we've been thanking our hardworking healthcare workers, rightfully so, and our emergency management, but I also wanted to say a quick thanks to all of our folks in the criminal justice side, all of the law enforcement, corrections officers, and our 911 dispatchers that have been working tirelessly throughout this whole process. They run very important 24/7, 365 operations, and they've been doing this without any issue, and have been keeping everything going smoothly. And I want to provide a special thanks for those important employees. A couple of positive notes. It's important to try to stay positive during all this. Genesee County is hovering around the 2% level for positivity, which is excellent, and compared to where we were just a couple of months ago, when we were leading the state and leading the region in positivity rate. The hard work of getting our numbers down is borne fruitful, and I am very happy to hear that our positivity rate is now hovering around the 2%. Another positive note is every single teacher in Genesee County that wants wanted to get their vaccination has had that opportunity. We can report that every single teacher has been given the opportunity for at least one dose and has had their first dose administered. So that's a milestone that we were working very hard to achieve, and we achieved that just the last week. And until recently, we have not been able to get into some of our larger senior complexes because of the low vaccine. But I'm pleased to say that Paul and his crew were able to get a couple of teams over to our larger complexes, 400 Towers and Washington Towers, and provide first doses. So everyone in those complexes that want a vaccine has been touched. And then very recently, I know Paul's going to be touching on some of this, and I apologize for stealing any of your thunder, Paul. But I know you're starting up with the homebound population, and that was an area that was sorely needed. It's a complex issue. It's a complex, challenging population to address, but I am glad to see that we've been given some special allocations for that, and there is an effort and meeting that need. Not enough for 100%, but I know that there is going to be, for the first time, an effort going out towards those homebound folks. So I'm going to turn this over to Paul to continue on with his best Dr. Fauci impersonation. I keep saying that because he is our own homegrown version, and Legislator Stein just left, and I definitely want to appreciate all her leadership as well. So Paul, I'm turning it over to you and giving us all the hopefully primarily good news.
All right. Thank you, Matt, and thank you, Shelley. It's always a pleasure to follow up with you guys, covering a lot of the thank yous and just setting the stage, right? Setting the table as we launch into some of this information. But I'm going to do it like I usually do and continue that. And I'm always going to continue to shout out to my health department staff and the team at the health department in both counties, right? So we have been going at this for over a year now. And the continued dedication and the long hours, many weekends, overtime, et cetera, addressing this pandemic head on have been really remarkable. The amount of phone calls and conversations and difficult conversations sometimes with all the different cases we've had, the unfortunate passings. It's truly a testament to the dedication they have to the residents of our counties. Our volunteers have put in hundreds and hundreds of volunteer hours at our vaccination clinics, at our testing clinics, and those efforts go forward. Again, it's truly amazing to see everybody working together to meet the needs during this time. So as I mentioned, we just did pass our 1-year anniversary of our first confirmed case in both Genesee and Orleans County this past week that we're in now. And, it's always important, I think, just to memorialize that a little bit and look backwards briefly and kind of the journey that we've been on over the past 365 plus days now. We at the health department were monitoring SARS-CoV-2 originally noted back in 2019, right? At the end of the year, we were starting to see some cases over in Asia and, China, and then starting to spread through Europe. So obviously it was on the radar back then, but, didn't really start showing up into the US till into 2020. But locally here, we had our first case in the region in Monroe County, which triggered a long weekend, to say the least. A lot of conversations around school closures, and we declared our state of emergency on March 14th, which we are still under. So we're over a year now of continual state of emergency declarations by both counties. It's a fairly unusual thing to see, but obviously it triggers and puts in place certain reimbursement streams and the ability to act and to respond quickly as needed to the pandemic as it's quickly shifted and changed throughout the past year. Again, we had our first confirmed cases and reported on March 16th for both Genesee and Orleans County. So over a year now, we continue daily reporting, obviously our press briefings that have gone out for over a year now. I know Nola's on here, she's our PIO, and she's going to be answering questions and posting links, I think, as I go through here in the chat box. So if that's helpful to anybody. Again, she deserves a lot of credit with pulling together a lot of this information with our EPI folks on a daily basis, putting together data so that we can report that out live. We've had many live press conferences. We've been doing these Zoom press briefings, and just a way to really get the information out to our public locally. Obviously we don't always have that opportunity. We're not necessarily in the bigger markets of Buffalo and Rochester. But we have made an effort to try to provide that information locally and to provide factual information as best we can. we've used our social media presence has increased significantly over the last year, obviously on Facebook, our website, Twitter, Instagram, those type of things. We launched the Go Health Minute, which we've had 28 different videos thrown up over the past year, focusing on different topics. We've had different people from elected officials to business owners share some thoughts on COVID and how that's impacted them and how it's impacting their lives and their businesses. So we've tried some different strategies to, again, push messaging out and share information with the public throughout the past year. But priority from day one, and we said this, if you go back to the press conferences when we had our first case a year ago, we wanted transparency. We wanted to be honest and open with the public and provide factual local data as best we could. And we've been doing that for ongoing over a year now, and we're going to continue to do that as long as needed, and hopefully shorter than longer at this point. But I do want to just take a quick second kind of to echo Shelley's sentiment and recognize our communities and the journey that we've been on. It's important to recognize the unfortunate lives that have been lost along the way and the way our lives have all been changed over the past year. It's been a tough, long year, right? We've seen a lot of frustration, worry, uncertainty, et cetera. But I think overshadowing these negatives, it's very heartening, I think, for me personally, to see the ongoing collaboration, the volunteerism, the resiliency, and ultimately the hope that's been put forth by our counties. We've traveled this road together over the past year, and I firmly believe we'll push through the end of this together and hopefully for the better in the end. So just a quick snapshot there. Just want to spend some time looking backwards, but I'm going to kind of run through some updates on things just to give everybody a little snapshot of where we're at. So regionally, from the data perspective, we've been watching our numbers trend downwards over the last month and a half. At our press briefing last month, I shared kind of a juxtaposition between some of the data kind of in our peak in the December timeframe to where we were at that point. But we've continued to trend down over the last, again, 4 to 6 weeks in the trend direction. It's leveled off a little bit overall for the region, but ultimately we're still averaging about 182 cases per day in the Finger Lakes region. We're at about a 1.64 positivity rate on the 14-day average and a 1.66 on the 7-day. So again, those are normalizing a little bit and have some consistency there. Hospitalizations, which is something we've talked a lot about throughout this pandemic. And fortunately, again, this has really trended in the right direction. You may recall around Christmas time, we were up around 1,000 folks in the hospital in the Finger Lakes region. We're down to 139 as of yesterday and 39 in the ICU. So those numbers, again, continue to look well overall for our region, and we're happy to see that. That's been our biggest concerns, again, throughout the pandemic. We're testing around 11,000 folks per day in the Finger Lakes region. And, looking at Genesee County's numbers, as Matt mentioned a little bit, we're hovering around 2.4% on the 14-day and around 2.7 on the 7-day. So again, fluctuation a little bit up and down. Obviously, Monroe County makes up the bulk of our percentage for positivity rates just due to their volume. But ultimately, we've been hovering around that 2% up a tick, again, comparatively speaking, but overall still a downward trend line. Orleans is at 1.8% on the 14-day and 1.7% on the 7-day. So again, reading from our briefing, typically what we put out on a daily basis, 5 days a week. Genesee County is at 4,480 total positive cases. We've had 102,794 negative tests, 59 current under mandatory isolation. So these are active cases that have COVID-19. 3 of our active cases are in the hospital. We've had 120 deaths. This includes community members and also those non-regulated facilities that are monitored and overseen by the State Department of Health or the federal government. 3,940 community members have recovered. So again, we continue to track and push those numbers out. Jumping to Orleans, we are at 2,498 total positives in this past year. 55,109 total negative tests. 42 currently under mandatory isolation or active cases. And just like Genesee, 3 of those 42 are in the hospital. We've had 82 deaths in Orleans County to date and 2,100 on the recovered side. All right, so one thing I want to spend a little bit of time talking about is guidance and guidelines. So this is very, very fluid. Continues to change. This again continues to be a common theme that we've seen going back to last spring when all the shutdowns came along, and then the reopening guidance. It changes frequently, and unfortunately, when it does change, it's often done through a press conference, and the guidance documents and the actual way it's supposed to happen, the implementation of it is often a week plus in the lag, sometimes even longer. As I start this, I want to just encourage everybody to continue to follow Forward New York. That still is the repository where all of the New York State guidance documents lie. So if you're a business, if you are a part of a club, a sports team, whatever it may be, that is the place that houses all of the approved current guidance. And again, some of it has not been changed since last June or July and updated. So which that basically means is that still is what's in place, and that still is what folks need to follow until the state officially updates and changes that. So again, keep in mind that formal guidance often lags behind the announcements of the change. We are starting to get a lot of questions from businesses, organizations, different events that are trying to plan for the summer. I think there's a lot of optimism and hope that there can be some of these events occurring this year that were all shut down and canceled last summer. And, we're hopeful locally that we can get to the point and that the state allows certain level of these events to occur. We're looking at parades, festivals, the fair, those type of different things that, again, did not happen last summer. And there's a lot of questions because folks are trying to plan now. So we are, advocating. We're constantly asking the state to put updated guidance out there as quickly as possible because we know it takes time to plan for these type of events. They don't happen the week before, right? They're happening now, the planning for them. So, we'll continue to push those things up the ladder, but we will ask folks to keep monitoring Forward New York. And again, when we know about them, we will share them through our daily press briefings and push that out. But some highlights that have occurred recently, obviously weddings, catered events, as of this past Monday, responsible parties now have some new guidelines to go by for, these different events. There's a 5-day notification requirement. So up on our website, we do have a link for these different types of venues. If you're going to be hosting events that fall under these criteria, you need to report that to the local health department, again, per the regulations. So again, it's more of a notification. We're not going out and inspecting. We're not reviewing anything per se. This is a notification to let us know the event has occurred. So that link is up there. So please, make sure you're using that if you happen to be hosting one of these events. But there are some requirements. I'm not going to go through all of them, but this is really the responsibility of the responsible party. But there is a testing requirement if you're over 50 people. So the cap is 150 people, up to 50% of the venue capacity. So testing 3 days prior if it's a PCR test, or within 6 hours of the event if it's a rapid test. Again, that's going to be potentially challenging for folks. So we recognize that. We've been sharing that concern up the ladder already with the state. That we need more access to asymptomatic testing, especially if it's going to be a requirement for attending events like this. Social distancing is still in place, face coverings, socially distant dancing, those type of restrictions are in place. But ultimately, it's the responsible party is responsible to make sure that they're in line with all these guidance. So again, refer back to our website for that link and fill those out if that impacts you. Also, non-essential gathering limits have been increased. So they're going up to 100 for indoor. So that's up from 50. It can also go up to 150 with testing. So again, if folks are tested prior to the gathering, then you can increase that capacity past 100. For outdoor events, it's up to 200. And again, up to 500 outdoors if testing is in place. So here we are again tied to testing and the need to figure out a process for that. Which, again, we continue to push up to the state. Private gatherings, so still inside is still at 10, and outdoors that has been increased to 25. As of today, March 19th, again, I know a lot of our food service establishments in our communities are pleased to see that the capacity is increasing up to 75% for all facilities outside of New York City. So that is taking effect today. We do realize that this isn't a fix-all, obviously, since this is still driven by needing to have tables spaced out, those type of scenarios. So smaller venues or with limited square footage are still going to have trouble even increasing to 75% with still maintaining the other restrictions that are in place. But again, we are moving the right direction with that, and hopefully, again, there'll be more updated guidance coming that'll continue to expand and allow for additional capacity in these venues. So hopefully, again, further modifications will be expected here, hopefully as numbers continue to trend the right direction. Obviously, beginning April 2nd, events, arts, entertainment venues are able to reopen at 33% capacity. And again, you got the different levels, 100 people indoors, 200 people outdoors. So again, there's a lot of criteria along those lines that I know our venues will be, again, referring to Ford, New York, and monitoring those guidelines. But again, moving the right direction, getting things open back up, even reduced capacity, I think is welcomed by a lot of folks to be able to go out and do some things. And then the other big thing to note, obviously, beginning April 1st, New York State's no longer going to require travel quarantine for domestic travel. International is still going to stay in place, similar to what it is, where you would have to do a test out option 3 days prior to coming back or 4 days once you're back. If you don't do testing, you would still have to quarantine for the 10 days. But any type of domestic travel, there'll be no longer any type of a quarantine or testing requirement traveling, again, within the states domestically. The other thing I just touch on real quick before I move on to testing, schools. So obviously there's been a lot of talk in the news that the CDC will be updating potentially their guidelines around distancing from 6 foot to 3 foot. There's been a lot of discussion around this around the region. I talk to our superintendents in both Genesee and Orleans County weekly. So we have ongoing discussions around this. And, again, locally, I've informed all the schools, we're not in a position and we don't have the authority to approve that change. It's really between the state and the school districts. Obviously, we can make recommendations, but ultimately, as the schools desire to move that direction, that's something that they have to, make sure that they're following state guidelines. So the hope is that if the CDC does make that change, if and when that happens, that the state will follow suit. Locally and in the Finger Lakes region, the rest of my colleagues, we've talked about it and we are supportive. If the recommendation is to go down to 3 feet, that can occur in Genesee and Orleans County. But again, we're not in a position to bless that necessarily and or approve it. That is a school district decision in line with what the state guidelines are. So ultimately, we'll see if that happens. If the CDC does move that direction, again, we would strongly advocate and push the state to adopt similar guidelines so that our schools have clear and concise direction on what they can and can't do. And there's consistency around the region and the state on this issue. All right, so testing, just real quick on this, testing continues to move forward locally. At one point we were testing over 600 people a week at our clinics back in November and December. That has waned off a little bit at our county run testing clinic. We closed down the Orleans County one about a month ago, and Genesee will be testing one more week at the emergency management office on March 23rd. That'll be our last test date over there. The following week in Genesee County, we'll be moving operations over to County Building 2 at the local health department. We will have a link up with appointments. It'll be appointment driven only, not drive up. Our hope is to have at least a minimum of 100 appointments per week, and this is asymptomatic rapid testing. In Orleans County, we're actually starting next week. That link is actually up live now. So if folks are looking for rapid testing in Orleans County, again, you would have to make an appointment. It's going to be at the county health department, so the county office complex in Orleans County. And we will do rapid testing there, again, a few days a week, offering hopefully at least 100 appointments per week. So again, as I mentioned, a lot of these guidelines are going to require testing requirements, and we know it's going to be a challenge. And we're calling on the state to increase rapid testing access for our residents. I know the governor announced additional testing facilities around the state. Most of them appeared to me anyways to be in the New York City area. So we need to see more of that in the rural areas. Again, our local ones are still Rochester, Buffalo way. And I'd encourage everybody to follow along with the vaccine or the testing tracker that the state has that does identify all the testing locations where folks can go to find testing. But we do know that's going to be a bit of a challenge as we move forward. All right, so I want to move on to vaccinations now and just provide some updates where we are with that. We are making progress. We are getting more of our folks vaccinated. The percentages trickle up day by day as people go to providers, go to pharmacies, go to county clinics, state-run clinics. But ultimately, if you look at the numbers, we're still lagging behind in the percentage of residents vaccinated. We've been very vocal about this for 3 months now. If you really go back and look at how the vaccine rollout has occurred, it's very clear that a lot of rural counties have not been given and afforded the same local access that has been given to the urban counties who have obviously larger numbers of allocations, but they also have state-run mass vaccination sites, federally run mass vaccination sites. So there's a lot of access for those folks within those communities, where in the rural areas, we're really driven by the county-run sites and whatever allocations may come to pharmacies or to the healthcare providers. And what we've seen to date is not parity, right? We have not had the same level of access locally that other counties have had, particularly the urban counties. So we continue to push, we continue to advocate on a weekly basis for increased doses to come our way. We're hoping that we'll see that happening soon. But we have continued to run weekly and multiple times per week clinics in both counties. Again, GCC is our site in Genesee County and the Ridgeway Fire Hall in Orleans County. As Shelley mentioned, we're on site over at GCC today doing well over 600 doses. That includes some second doses, but also 400 initial doses. We did close to 600 yesterday at Ridgeway. So we have the capacity locally, and we've been very clear. We've written a couple letters now to the governor and the state asking for more vaccine, basically articulating our ability logistically to handle it. And we just need the doses so that our residents have a fair and equitable opportunity to receive that vaccine locally. So we continue to be overall successful in this. As I mentioned, our numbers have, again, continued to trickle up, and I'll share that data in a minute. We've also continued to partner with our other agencies in the community when we do get vaccines. So we've been working with pharmacies, working with providers to share some of the allocations when we get it, to make sure they're getting to their patients as efficiently, as effectively as possible. One thing I want to do is just still let folks know it is challenging. We recognize that to find access to appointments. The state system and the approach to this is very truncated. There's multiple avenues that you have to go to if you're looking at one of the state sites, which they did just open up another round of state sites. We were hoping that one would have been located at GCC. Unfortunately, that did not happen, at least in this round. But the state sites, you have to go through the state site to register. If you want to register for the county sites, you got to go to the county website. If you're looking to go to a pharmacy, you may have to go to several different pharmacies to register. So it's not very easy. It's complex, and we know that's been challenging for some of our residents to maneuver through that process. But hopefully, again, at least on our website, I know we do offer the links for all of those different locations. So if you at least come to the Genesee Orleans Go Health page, you can at least click on different links and try to get to them from one spot. As far as the state mass vaccination sites, again, additional ones were opened up, but the nearest to us were Niagara Falls and Corning. Again, not overly close. We still believe, and I'll still lobby, that the GCC site is an ideal location for the state to set up shop. It's right in between Rochester and Buffalo. You're pulling from many rural counties, but also the east and west sides of the urban counties. But to date, that has not been something the state has wanted to move forward on. We also obviously did that mass vaccination site a couple weekends ago, which overall was very successful. We pushed out 3,500 doses in 5 days and easily could have doubled that volume if we had the vaccine. A couple things to note here. Just want to make sure I'm putting this out there. If you're vaccine shopping, so to speak, that's what we're calling it, looking around, signing up for multiple sites, we'd encourage you to not do that. We know it's very tempting to keep looking and trying to get an appointment that's earlier and earlier. It does take up available spots for others that are looking for appointments, because if you're holding 2, 3, 4, 5 different slots at different dates, different locations, it obviously restricts and minimizes the appointments that are available for others. So please don't vaccine shop, so to speak. And if you do, one thing we want to make it very clear is, once you get your vaccine or you settle in on an appointment that you're going to go with, please go on and delete out and cancel those other appointments. That way those spots will be released and open back up. So in our systems, when you cancel, it'll actually open that back up publicly so that someone else can grab that slot. So it's very important that you do that. If not, obviously those appointments get held and booked up, and then they end up as no-shows essentially because you're not going to be there to get it. So again, be cognizant of that and try to minimize that as much as possible. The other thing is that we're having an issue, and this isn't just with us, this is regionally and across the state. We're really starting to see a lot more challenges with second dose vaccinations. We really need people to think and to consider, are they going to be around in 4 weeks if it's Moderna, or in 3 weeks if it's Pfizer for their second shot? Everybody that comes through our clinic, we ask them probably 3 or 4 times before they get their vaccine, can you commit to coming back to get your second shot? And it's becoming more challenging because people are calling and saying, I can't come in now that date, we're going to be out of town, we scheduled a vacation, whatever it may be. What happens though, if you look at the process of this, we automatically get the doses for the second shot 4 weeks from when we gave the first shot. It's automatic, so your dose is allocated to you coming back 4 weeks or 3 weeks if it's Pfizer from that initial shot. So what's happening is, if you don't show up, obviously we use that vaccine for other people, but we no longer have a dose for you that's been set aside based on your first allocation and your first shot. So what's happening is we're getting a lot of people that are unfortunately not able to get their second shot because of this. And it's a challenge because now we're trying to get them in at a later date. Obviously, we know we can do that. It's not harmful, so to speak, to go out further, but it's not helping with logistics and getting those numbers done. So we're just asking, if you're going to come get your shot, and we want you to, just make sure you can commit to coming back when we schedule for that second date. We're also seeing this with our snowbirds and other residents that may be coming back and traveling from different parts of the country. They may have received their vaccine in the other state, and now they're coming back looking for their second dose. Again, we will do our best to accommodate, but it may take a while to get you looped in because, again, we were not given a dose and we don't have an allocation for you since you got your shot in at another location. The other thing, obviously, eligibility continues to expand. As we know, we're up to 60 plus, people with comorbidities, 18 and older with Moderna and J&J, and 16 and older with Pfizer. 1A and 1B groups continue to expand. Starting this past Wednesday, public-facing essential workers, governments, non-for-profits, public-facing essential building service workers. It was opened up to all these different groups. So again, please look to our different web links around for upcoming clinics. We'd like to get you in if you're willing and wanting to get the shot. The other thing, obviously, providers have now been increased the availability of who we can give the vaccine to, which is very helpful for us moving forward now. As I've talked the past several months, we've been restricted. We can only give it to essential workers. We can't give it to 65 plus, those type of restrictions. Those have all been lifted now by the state. For most providers anyways. So our clinics are open to all eligible at this point. Pharmacies still have a restriction of 60 plus or teachers. But as Matt mentioned, fortunately, locally in Genesee and Orleans County, we made a concerted effort to work with our schools and get all of our teachers in who wanted to be vaccinated. And we have completed that. Obviously, if those folks want to come online that didn't take advantage of that earlier on, they can just join into our normal clinics at this point. The last thing I want to note before I just give the numbers update on our vaccinations locally, all the vaccine is effective, whether it's J&J, whether it's Moderna, whether it's Pfizer. And I really want to encourage folks to, take whatever vaccine availability comes first. Obviously, as I mentioned, if it fits into your schedule, especially with the second dose, making sure you can come back for that. But all the vaccines effective, it's all effective at saving lives, reducing severity and symptoms, and regardless again of where and when you can get it, when you're eligible and able to, I'd encourage you to get any of the three that you can. We've heard a lot of people saying, well, I'm just going to wait for a certain type, and again, that's your prerogative. We're not saying you can't do that, but ultimately the goal here is to get as many people vaccinated as quickly as we can. Matt mentioned the homebound, so we have been working on this. This has been a conversation for many months, actually, how we're going to, and not just here locally, but around the region, work with this population. There are many logistical challenges when you go door to door, basically, to deliver vaccine. You have time periods you have to wait after the shot. You have to have epi with you when you go. You have to have multiple staff go out. So it's not as easy as, it is at these mass vaccination sites. But it is very important to us that we obviously recognize this population and the need for them to be vaccinated. As Matt mentioned, we have started to go out to some of these different senior living centers and working on them. We did receive a small allocation of Johnson & Johnson for homebound that we're working with our Office for the Aging on this weekend and upcoming week to get some of those folks done that we know about. So as we identify and, identify more homebound folks, our plan is to obviously develop a list, and we'll get to those folks as soon as we can. The Johnson & Johnson vaccine is strongly preferred. Since it's a one and done, we can go in and do the shot, get them protected, and then not have to go back again in 3 to 4 weeks, depending on the vaccine. So we are working to address that population in concurrently while we're running our mass vaccination sites. Ultimately it takes many hands. We're obviously limited with the capacity and the workforce that we have, even within the health department and all of our volunteers. So it is a collaborative effort, again, working with our community partners and providers, pharmacies, potentially home care agencies moving forward to make sure we can get the shot to the folks that want it and need it, and in the environment that, potentially fits them best. All right, so just a real quick thing before I wrap up with numbers. So again, I would point you back to the state site. If you look at the COVID-19 vaccine page, right, that there's a link there that Nola will probably pop up. So I'd encourage anybody to monitor this. This is really the most up-to-date data that we have. It's usually about a day in the lag, but ultimately it does show where our vaccination rates are. It's the whole state. You can look by region. You can drill down into some different demographics. So there's a lot of information there. And I would encourage folks to monitor that as we move forward. But just a quick snapshot as of yesterday, we're right around 4.8 million New Yorkers have received at least their first dose of vaccine, which is, again, about 24%. 2.5 million New Yorkers have received their second dose, so they're fully vaccinated, which is about 12.4%. Drilling down to the Finger Lakes region, we're around 315,000, 26.2%. So Finger Lakes region as a whole is doing better than the state as a whole in getting vaccine in the arms, at least on the first dose. And we're at about 159,000 or 13.2% with fully vaccinated second dose in the arms in the Finger Lakes region. Looking at Genesee and Orleans, for Genesee, we are around 13,000 with their first initial dose, or 22.7%. So again, lagging New York State by about a point, 1.3%. But again, compared to the Finger Lakes region, again, a little wider gap there. Around 7,200 or 23% have received their full series. And then looking at Orleans County, we're at about 7,300 or 7,300 with their first shot, 17.8%. A little bigger gap there. This is where we continue to push this to the state. Wyoming joins in at that kind of in between Orleans and Genesee, again, showing that rural disparity in our percentage of residents vaccinated. So we need to see that come up, but 17.8% with one shot in Orleans and around 3,500 with their second dose, around 17%. So ultimately, we do understand there's a lot of challenges with seeking and getting vaccine. There has been a lot of changes, continues to be a lot of changes and challenges for our residents to be able to access the vaccine and get appointments, especially with broadband issues, limited connectivity, a lot of our seniors not being able to maneuver and get online and be able to be competitive when it comes to finding appointments, which is often challenging and frustrating. But as vaccine allocations increase, we're going to continue to push that out as quickly as we can through, again, multiple venues, our mass vaccination sites at providers, pharmacies, and our goal is to get it in the arms of those that are eligible and that want it as quickly as we can. All right, so that's it for my updates. I'm going to we'll open it up now to the press to answer or to ask questions. One thing I would ask is, just state your name and your affiliation, and we will do our best to answer it. I know Matt's here. He can help chip in if needed. And if we do not have the answer, we will go get the answer for you. Again, Nola is on, our PIO, capturing these questions and putting information in the chat box. So we will open it up now and have some dialogue. So,
hey, Paul, Howard Owens with the Batavian. How you doing? Can you hear me? Can you hear me, Paul? Paul, can you hear me? Hello? Hey, Paul, Howard Owens with the Batavian. Can you hear me?
Yeah. Hey, Howard, how are you?
Good. So, everything about this call has been pretty positive, so I kind of hate to be kind of a Debbie Downer, but I wanted to ask some forward-looking questions.
Sure.
It strikes me that, given what we went through last summer when cases were really down, and now we've got the vaccine, we're likely to face a summer where it seems like this has gone away. Are you concerned about complacency setting in, and what's your projection for the fall? What would you want people to be thinking about to avoid that complexity coming into the fall, the complacency?
Yeah, no, I mean, it's a great question, Howard. As we've seen, this is a novel virus, right? We don't have a lot of data on it and how it's going to, continue to move through our environment moving forward. We've seen our numbers, again, tail down and level off. The vaccine, we're vaccinating more and more every day. Obviously, we don't know yet the long-term effectiveness of the vaccine, and that's being studied right now, which comes into play with the kind of the 90-day recommendation after your second dose. There in all likelihood there'll probably be a recommendation of a booster shot potentially in the fall or early next year for even folks that are fully vaccinated. But I think when it comes to complacency, we really need to just keep an eye, on how things progress. Obviously, there's still masking requirements in place, distancing recommendations again, and it's fluid, right? So we're seeing changes come as we learn more. And this is not uncommon with new viruses. We need to understand them. We need to understand how it changes. And ultimately that will inform, the process moving forward. I mean, I think there is a lot of expectation and hope that this summer and heading into the fall that, we'll be in a different position. Hopefully we'll again start to continue to move towards that herd immunity and making sure that we have enough of our folks protected. And ultimately the goal is really to protect those that are most vulnerable, especially our seniors and those with underlying health conditions. And, we'll have to wait and see, I guess, how it plays out. But complacency sometimes comes back to bite us, right, in different ways. And it's important to just stay vigilant and make sure that we're still monitoring and, following the data, following the facts, and ultimately thinking of others, which is often sometimes lost, as we move forward. And it's not always about ourselves. Sometimes it's protecting our loved ones or protecting others that may be vulnerable or may be more susceptible to illness. So as we move into fall, obviously we'll have potential, again, flu season starting again. And, I think at that point we'll have a better idea of how the vaccine's holding up around the percentage of folks that have been vaccinated by then. And it'll help inform our decisions moving forward.
And somewhat related, especially kind of your last remark, one thing about the vaccines I don't think we know is how effective they are for how long. And we don't know, I don't know. One of the things I wonder about, and I'm just curious about your thoughts, is some of those first people being vaccinated might need boosters come fall or winter.
Yeah, absolutely. And I think that's been mentioned several times, and that's the data will show, right? I mean, they're going to be testing antibody levels. They're going to be looking to see how well the vaccine holds up. Obviously, there's potential, there's mutations out there, right? We have different strains that are, circulating in the U.S. right now that, are obviously more infectious. They don't appear to be more severe. But as the virus mutates, they're going to have to continually study and monitor to make sure that the vaccine that we have and that we're using is effective. A booster shot in the fall or early next year, would obviously take into account potentially these mutations and other strains. And, again, boost that immunity back up and keep people protected. But again, we have a ways to go. There's a lot of, obviously, research and studying going on, papers coming out, literature on the virus itself and the different responses and obviously controls that are in place and, that'll help inform the decisions moving forward.
Great, Paul. Thank you. Have a good weekend.
Thanks, you too, Howard.
Paul, it's Tom Rivers with the Orleans Hub.
Hey, Tom, how are you?
Good. I didn't know if you had a magic number that you were aiming for with the vaccine, I guess, percentage, I don't know, 70% or something like that you guys are aiming for?
Yeah, I mean, I think again, if you look at herd immunity and where you want to get, I mean, that 60-70% would be a minimum, right? And that would include people that were already exposed and already had COVID. Ultimately, we want our entire population that's able and eligible and willing to take the vaccine to receive it. Yeah, I mean, obviously, we know there's vaccine hesitancy out there. We're not going to get 100% to take the vaccine, but the more that we have, obviously, the better chance we can get to that herd immunity level and make sure that we can minimize the virus spread in our community. And again, it's ultimately about saving lives. It's ultimately about protecting, especially our most vulnerable, as I mentioned, our seniors and underlying health conditions. So the younger, the healthier those who get vaccinated and protect themselves from getting the virus, and obviously protect potentially passing it along. I mean, that's really where the efforts are around right now. So I wouldn't say there's a magic number per se, but we have a ways to go if you look at our numbers right now with, right around 20, low 20% overall vaccinated.
If I could just ask too on the 3 feet with the schools, just to make sure I understood that. So the school, you would wait for the state guidance or to see if the state follows the CDC. And at that point, each school district would vote themselves? Whether they would do the 3?
Yeah, so looking backwards, you got to remember every school submitted a reopening plan last summer. And in that reopening plan was developed around the state guidance that was put out through state DOH and the education department. So they all have plans which incorporated 6-foot distancing, masking, and over the past 6-7 months now of the school year, plans have been modified. Schools have done a few different things, based on data and science and trying to tweak, get some more students back. But ultimately, the decision to, move down to 3 feet, again, that's not a local decision. Local health departments are not giving an approval per se. We provide guidance, but ultimately it's a decision between the school, the local school, and the state. The schools are responsible to follow state guidelines, whether it's state education in consultation with State Department of Health. But as I mentioned, we would like the state to follow whatever the CDC recommendation is. There are some counties that are starting to offer some, different advice and counsel and recommendations, but ultimately, from a liability standpoint, et cetera, the school is just like the county. Matt can attest to this. We have to follow the state guidelines and executive orders. So ultimately, the schools are in the same boat. So we need the state really to align to what the CDC is saying around the distancing from 6 foot to 3 foot. And, if you really look going back, I mean, schools have proven, especially locally, to overall be very, very safe. We've seen very, very little transmission within students at the school setting. We've had a lot of positive students, and most of the exposure, if you look at the epi, has been traced back to out of school activities, from gatherings, from parties, from kids getting together on the weekend, but from kids sitting, in the classroom day to day, we have not seen any significant amount of spread in those situations.
If I could ask you too, we are playing football here, maybe next week. And I don't know if the governor's guidance with the outdoor sporting events, if we're still limited to the 2 people per player, or can you have more at these high school football games?
Yeah, so this is a question we get commonly, and the answer is really, if you look at the high-risk sports guidance, which was put out, football falls under the high-risk sports guidance, which is still restricted to 2 spectators per athlete. Now, with that being said, that was put out with the idea of indoor sports, basketball, et cetera, which are just wrapping up now. We have already raised that question several times up to the state and asked them if they're going to be updating and encouraging them to consider updating that, because again, now we're outside. You have stadiums and venues that can obviously hold a lot more than 2 spectators per athlete safely. Well more than 6 feet apart, especially if wearing masks. So we are hopeful that the state will provide some additional guidance around sporting events, football and other ones that may be starting outdoors here. But at the moment, it's still under the New York State high-risk sports guidance, which is still 2 spectators per athlete.
Yeah. All right. Thanks, Paul.
Yep.
Paul, this is Lynn Johnson. Can you hear me?
I can, Lynn. How are you today?
I'm good. I just, in wrapping up this call, I'm chairman of the Orleans County Legislature, and Jack Welch, our identical position of Matt Landers, is our chief administrative officer. And we just wanted to take a moment to thank you for leading the charge for these two counties. I echo Shelley Stein, chairman of Genesee County, in the fact that you have taken us counties together. I can't walk into a general practitioner office or one of my school districts or without massive accolades for your leadership. And I just wanted to wrap up the call and say probably the best decision that Shelley and I did was appointing you as our public health director. So we thank you for all your work, and hopefully we're seeing the end of this. Thanks, Paul.
Thanks for those comments, Lynn.
All right, I think that's pretty much it, Paul. I think you answered a lot of the questions with your report, very comprehensive. Again, I appreciate everyone coming out and reporting on the information that Paul's able to provide. This is a continuing effort of Genesee and Orleans County to make sure that the people around, hear the news right from the source. And Paul, again, we've all said it, but I appreciate all the hard work throughout this process. And we plan on doing this again probably next month and keeping this month format, and hopefully look forward to the day that we don't have to do this kind of stuff anymore. So take care, everyone.
Thanks.